going to, first of all, just spend a few minutes reflecting on the film, and also they've been asked to reflect on the question of how research, what can research do for Daniel Blake? And then once they've spoken for a few minutes, we'll open the floor up for your questions and hopefully get a bit of a discussion going. So I'll just briefly introduce each of our panel members. I'm Anne McMunn, by the way, reader in Quantitative Social Science and Population Health in the ESRC International Center for Life Course Studies in Society and Health. So life course epidemiology, interested in the social biological interface. We have Nicola Shelton, who's a reader in Population Health here at UCL. She's also head of the Health and Social Surveys group within our department, which houses some of our big important data sets in the country. So the English longitudinal study of aging, the ONS longitudinal study based on the census, and the Health Survey for England, and others. She's a health geographer by background, does research in alcohol consumption and physical activity, amongst other things, and runs our BSc in Population Health, as some of you know. Professor Andrew Hayward is Professor of Infectious Epidemiology and Inclusion Health.
That's a mouthful, right? Yes, but it's correct.
And he's currently Interim Director of the Institute of Epidemiology and Healthcare. And he's developed a research group in infectious epidemiology, but not related to sexual health infection, is that right? And I think that's the extent of my... You'll tell us more, I'm sure. And Professor Graham Scambler is Emeritus Professor of Sociology here at UCL. He's written extensively in books and academic papers, as well as online, about health inequalities and social theory in relation to health. And he also started a journal, Social Theory in Health, which I believe you still edit, is that correct? And my memory of Graham is that he introduced me to critical realism, so I will always be grateful for that. So that's our panel members, and they'll go through and just reflect on what they think research can do for Daniel Blake, and any further reflections on the film. So, Nicola, would you like to kick off?
Okay, I'm going to start with a bit of history. Over 200 years ago, Malthus argued that we didn't have enough money to pay for state support for people who didn't work. And he was wrong. Industry changed, industrialisation happened, and we were able to support people in a far greater way than we were able to do before. And now we're being told again that the state can't afford to support unemployed people. And I think we're wrong. That's wrong. With the digital economy, globalisation, there are opportunities for people to actually be able to work less who are working, and for those who are not working to be working. But we need to work out how to do that. Work by the Research Network on Extended Working Lives using the ONS longitudinal study has shown that people who are most able to work near to state retirement ages are likely to be in the professional sector, so they're people like us, and thereby probably least likely to financially need to work. Manual workers may experience a similar number of years of their lives post-working as non-manual workers. But these will start and end at younger ages, as they did in Daniel's case, and more of those years will be spent in poor health. Daniel's case, though fictional, is not atypical. John Cridland, who was the author of the State Pension Review recently, recommended that we spend up to 1/3 of our lives in retirement. Given that Newcastle's life expectancy is around 75 years, Daniel should have retired around 50. He's 59 in the film. And given his early death, he actually should theoretically have retired around 40. And additionally, our research has shown that the odds of remaining in work for older adults near state retirement age are actually lowest in the North East region. International comparisons of retirement policies showed that as a carpenter, if he'd lived in France and not England, he would be entitled to an earlier retirement age, both due to the arduous nature of his work and I'm assuming he started work much earlier than other people with professional degrees would have done so. So, they take him to the job centre, they say he should do something else. Could he have done anything else? Sadly, he lies facing double jeopardy. Analysis of the linked census data shows that if he worked as a carpenter in 2001 without a limiting long-term illness, he'd have double the chance of still being a carpenter in 2011 if he didn't have a limiting long-term illness in 2011. Additionally, carpenters with limiting long-term illness were almost twice as likely to have no qualifications as those who were carpenters without limiting long-term illness. They were twice as likely to be in work. Differential occupation and retirement ages by region were ruled out by that state pension review. But our research shows that those differentials exist, policy exists elsewhere, and it's clearly warranted in Britain too. Put simply, our research on extended working lives show that Daniel Blake should have been entitled to enjoy a retirement.
Thank you. So, to my mind, this is a film about austerity. It's a film about bureaucracy and punitive bureaucracy. It's a film about the impact of policy on people and on people's health. I think it's a film that really helps to demonstrate the fact that many millions of people in this country walk on a thin sheet of ice. Once you start to fall through that ice, things can spiral out of control very quickly. If Daniel Blake had not died in this film, there would in fact have been a much higher chance for him of becoming homeless. Part of the work that I do in relation to infection has been working with homeless people and starting to see the health consequences of homelessness. We can see, very interestingly, if you look at people who are homeless, about the life experiences that they've had, they include many of the things that we see in this film. Bereavement, loss of a job, loss of their dignity. For Katie in this film, experiencing survival crime and then sex work. These are common experiences amongst homeless people. And I think what's hard is getting across these concepts of relative poverty and the importance of that. But I think what we're also beginning to see is what's invisible, and it's invisible to people like me in a way who are middle class in Newcastle. We don't see in our faces the food banks. We don't see what's behind the closed doors. We don't hear these stories. And I think that's what's so important about a film like I, Daniel Blake, is it helps to make the invisible visible, and it helps to make the acceptable unacceptable. And I think that's what we should be thinking about as researchers. How can we use research to shine a light on these problems and on their impact? How can we use research to make these invisible problems visible to our policymakers, visible to our local services, and how can we advocate for people who may not have a voice of their own? So I think there's a lot that we can do in research. I think the work that Michael and many others have done at the policy level, showing the impact of social inequities on health, is critical, and it is ultimately a political question. But we also need to do work that is working more at a local level. So this film, a lot of it is about the difficulties of the system, the intractable and seemingly perverse nature of the system. But the people working in these systems are are humans too. I believe, many of them are really wanting to do a good job. How can we work with those systems to understand the barriers and the blocks in the system? How can we develop new models to help people navigate these systems? What would that look like? What would be the impact on health? And finally, I think one of the things that came through for me in this film was community and the importance of community resilience and support. How can we foster societies that develop that level of community support? I think we need to start moving away in our research from purely describing the problem to really starting to look at some of the solutions and how those solutions might work. And that, for me, is the challenge of the future. Thank you.
Thank you. Well, it's the first time I think I've been introduced as a lovely panel member, so that is very welcome. I want to be a little blunter than my colleagues have been, and some people may not be surprised altogether at that. If you look at food bag usage now, the best estimates we have, and they are estimates, is that there are about 1.25 million users. And we're drifting to a situation, I think, in which they're becoming institutionalised. They're becoming part of a post-welfare state way of coping with poor people. They're already institutionalised in the States and more recently in Canada. So there's a risk that this last resort way of coping is becoming part of a new system. Let me read you out very briefly 4 cases of people being sanctioned, just to rub the point home that this is a vicious, unacceptable regime. These are 4 or 5, I think, real cases. A man was sanctioned after he missed an appointment because he took his mother to chemotherapy. A woman had an interview which lasted longer than she expected, so she was 10 minutes late for her job centre appointment and was sanctioned for a month. So nothing, no payment for a month. A man was sanctioned for being 2 minutes late, even though he'd turned up 5 minutes early, but wasn't allowed to go upstairs to see his advisor until the security guard said so. Another man missed an appointment after he travelled to Scotland for a family funeral for 4 members of his family who'd been killed in a car crash by a drunk driver. He was sanctioned even though he rang the job centre to tell them he wouldn't be there. A woman who went on a health and social care course the job centre sent her on was sanctioned for not going to her job centre appointment even though she was on the course the job centre had sent her on. So these are sanctions imposed by a private for-profit company employed by the government and rewarded for sanctioning people. Atos on appeal had 40% of its judgments overturned. So this is an iniquitous system that is being imposed on us. And I don't think it's good enough just to talk about a system. We have to ask why this system and why now. And if you think about the shame that Katie felt in the film, why doesn't Ian Duncan Smith feel shame? Well, the reason is it takes power to impose shame on somebody. And increasingly we're seeing blame added to shame. Ian Duncan Smith and his confederates don't feel shame because nobody can force it on them and make them feel that way. I think if you want to look at and help explain the situation of people in desperate straits, like Daniel was in the film, you have to look not just at their situation, but at what are often called the super rich now, the fraction of the 1% the Occupy movement refers to, who are going into the stratosphere with their rewards for what they do, whilst other people are sinking at the bottom. We have to ask why. And in my terms, we're looking now at a transnational class or elite that is cashing in and rigging a system in its favour. And this is why we have people struggling at the end. They don't give a shit about people like Daniel Blake. So when we talk about doing research as a way of influencing policy, you can't disagree with that, and Michael spent his whole career doing that, and it's thoroughly worthwhile intervention. But it's changed nothing. We now live in a society which has shifted and made the health inequalities and inequities that Michael has written so eruditely about and researched so well, wider and deeper than when he started his career. So it's not just a matter of doing the research, vitally important, and feeding that into policy making. We have, for the most part, not evidence-based policy, but policy-based evidence. So we've seen repeatedly governments of different complexions choosing the policy they want and then looking around for the evidence that might support it. And if the evidence doesn't support it, they suppress it. So I think one of the questions that academics like us need to try and answer is, what do we do when our research findings are ignored or rubbished or subverted? Do we get another grant in? Publish another paper in a high-impact journal? It's not going to do it, is it? So I think we have to explore ways, and this surprised perhaps to sociologists more than others, because we look at the society as a whole and ask how health and its institutions reflect back on that society. So maybe we have an additional obligation to try and make people listen to what is a well-established research base these days. So the question in a way I would like to leave you with is, knowing all this, and Ken Loach insisted, I think rightly, that Daniel Blake follows the evidence. This is not exceptional. This is what is happening to people in the 5th or 6th richest country in the world. It's intolerable. But you can't ask people to give up a little of their power and their riches. It doesn't work that way. You have to look at ways of taking it from them. And that leads to a whole set of deeply significant questions that academics are often uncomfortable with. But let's not pretend they don't have to be asked. And the second question, I think, is this issue around where we take our research agendas at this point in time. Because we have researched continuously the links between people being poor and deprived of resources, social as well as material capital, so that we know what is happening to people and the health consequences in terms of premature deaths and the rest of it. We know that very well, and it's important, and we need to keep up the research. What else do we research? And my answer is, you look at the wealthy and the powerful, who now constitute a kind of plutocracy, or in my terms, governing oligarchy in our society, which is not in any real sense democratic. I mean, look at the election. You'll be asked to vote tomorrow. Look, what is it? Is it 60% or so of the mainstream media owned by two non-dom, non-tax-paying exiles, telling us that we've got to vote Tory because Corbyn's rubbish? And BBC researched the bias against Corbyn is shown in the literature. So we have a rigged system and a partially rigged capitalist rather than parliamentary democracy. I better stop there.
Wow, very intriguing. Thank you, Graham.
You know, the idea is that if you give everybody a certain level of income, that will not only assist in the growth of the economy, it will remove some of the dire situations in which people find themselves. And it's being actively considered in a number of other countries. And there's even talk on the left rather than the right in this country of experimenting with versions of it. So for some people, it's an idea whose time has come. And the economic argument, in a way, is that if poorer people are given a boost in their income, they will spend it. And they will spend it in a way that boosts local and national economies. You know, the super rich don't spend it in the same way. They might buy a yacht some may put it in a tax haven or whatever it is. Poorer people have to spend it. So one idea or one possible consequence of a basic income is this will generate a movement in the economy, as well as remove some of the worst aspects of living in these kinds of ways.
One, it's not quite universal income, but one model that I saw in Canada, which it didn't last particularly long, but they managed to get through some loopholes whereby they could do essentially poverty assessments within primary care settings, and because they demonstrated the link between poverty and disease, they were then able to use that in order to have cash transfers prescribed to some of the people who were living in poverty. And there was emerging evidence that that was starting to have an impact on health. But pretty soon the loophole got closed down, so it didn't work anymore.
Did you want to comment on
Yeah.
that, Nicola?
Generally, universal benefits work well at reaching the very poor because everybody claims them. So child benefit is now means tested. It didn't used to be means tested, it used to be universal. Very few poor people, Daniel with his low levels of digital literacy, struggle with the process of claiming. And the idea that we shouldn't give money to rich people, therefore we should means test. The problem with it is then the poor, it doesn't reach the poor either. It reaches the people in the middle. So there's some argument for yes, a universal income would be good, but it's not enough on its own. And that's the problem with it, is it the first thing that then gets cut? If we decide it should be £5,000 a year when we're facing austerity, do we say, well, let's this year make it £4,000 because actually people don't really need £5,000? And I think that's the danger of it, is you set it a level and then that level will just drop.
Okay.
Can I make a very quick point?
Yes.
I think that let me give you two examples, and I'm not speaking conspiracy here. We have evidence of this. When the 11 plus was brought in, the civil servants calculated that we needed 4 out of 5 people who took it to fail, and they were destined to go into manual jobs, of which there were many more at the time than there are now. It was calculated. Nicola's absolutely right. If you go from universal benefits to targeting, less of the people who need it get it. And that's calculated. The forms are made so complicated to fill in that numerous people will fail. They're driving people online in full knowledge that that is a real problem for people like Daniel. There have been offices investigated that have been told not to keep the forms because then it's too easy for people to get them and fill them in. Make them apply for the forms to seek their benefits. And, you know, this is not some kind of conspiracy theory. We know this from the research process. It really is calculated in advance roughly what percentage of people who are entitled will apply if we use method A as opposed to method B. And that applies to whichever political party is in government.
Can I quote something?
Sure.
Please follow this guidance from the ESRC. The ESRC advises against issuing press releases or announcing new research in or about the referendum during this period. This is not in relation to the general election tomorrow, this is the referendum on the EU. Any press releases that are scheduled to be issued during this time should be sent, as always, to the press office a minimum of 2 working days before they're planned. The ESRC advises against holding any launch events or any other events that deals with any of the issues raised by the referendum question during this period. If you have an event already scheduled that you think may impact the referendum, please contact us for guidance. We're actually told not to do what you recommend. If we have funding from a research council, we are not supposed to acknowledge them if we are going to be political in the period approaching an election.
Well, and in science, we are taught to be impartial, right? We are taught that we find the truth and present it to the world. But maybe that's not the way we should be teaching scientists. Andrew.
I think it's hard not to have a political angle with this sort of information. But I think it's also really important as scientists to make sure that everything that we do say is backed up by evidence and facts, and that's one of the key strengths of science. One of the things that I find not only in this area of inequalities is that there is a tendency sometimes for researchers to sort of think, well, my job is to do the research. It's somebody else's job to implement that. And this is why, so many randomized controlled trials or evaluations and things like that never lead to anything happening. And I think it is a researcher's job to engage in the consequences of their research and the implications of that research, whether that means doing the sort of thing that Michael's doing in terms of, directly working with government bodies, whether it means actually trying to talk to the people who are delivering the systems that we're complaining about, trying to get in and change things. So whether that's political or not, I think it's just acting on the evidence. I think we have our political lives, if you like, outside of your research and your political views. I don't know. I think you shouldn't be afraid to speak truth to power. I think that's a really important thing, and it should be something that is a privilege of academia to do that. I used to work for Public Health England, and one of the reasons that I left, in a way, is because it was hard to sometimes say what you wanted to say because of the political considerations for it. In a research position, despite the restrictions that people put on us, you're not likely to come under lose your job or anything for saying things that are political.
Three very quick points. I think we're more likely to write a peer-reviewed article on talking truth to power than we are actually to talk truth to power. And I think there's a risk that as academics we are becoming increasingly tamed. Nicola's reading out the Research Council's report indicates that in a way. And certainly I have a number of colleagues who will agree with my ludicrously radical line in the bar, but would never write anything like that because they need to get another grant in and they feel they're blotting their copybook. So I think there's a taming aspect to it. There's also some kind of illusion that all research will be neutral in relation to value, except that if we want to do research on whether hip replacements work, we assume that is a good thing they do work, and if they do work, it should be rolled out into the community. People don't see that as political. But if you do the same kind of thing with health inequalities, they do. And that has something to do with the threat you could possibly pose to people who don't want their stances challenged. I think also, to go back to your point, and finally, I've argued that sociology should also engage in what I call action sociology. In other words, don't just stop at publishing an article or even making that widely available. You have to follow up when you're rubbished. And it's tricky, as I think Richard Wilkinson and Kate Pickett found with the Spirit level. They were rubbish because it was an unwelcome message. And in a way, as academics, they were not initially equipped to deal with the political field that they found themselves in. The other thing is, I think there's a genuine difficulty moving from professional sociology, doing the research, building the theory, which I think is absolutely essential if we're, as sociologists, we're going to be any good at anything or have anything to offer, and to this engagement in a political field. Because you're moving from one logical way of thinking to another. And that move has risks. And you've referred to the risks, really, around smoking and so on. If you do engage, you enter the political field, you stand to lose something as well as gain something. I just think we have to find ways of doing that. But I totally accept that it's difficult for post-baby boomer academics who don't have the freedom and space that I was lucky enough to have, and also in relation to their career building and grant funding and so on. Yeah. If you want to know about food banks, I would recommend this piece of ethnography, but set in a quantitative context around figures of usage and so on. Kaylee Garthwaite's Hunger Pains, Life Inside Food Bank Britain. And she worked in the food bank for 2 years as a volunteer. So, yes, I take your point. Yeah.
And I think one of the criticisms of the movie that came out was that perhaps they were being a bit unfair to people who work in job centres who are doing a difficult job. But actually, this is evidence here in this book that that's exactly the kind of thing that's happening to people.
And I agree with Michael. I don't think, we're seeing evil people in these centres. We're seeing people themselves trying to get by on actually rather low incomes, often doing the best they can for people with whom they have deep sympathy. So we're not talking about an evil group of people working a system against us. The evil ones are way up there.
Yes, and I think there probably is also an aspect of institutionalisation. The cultures develop within organisations, and people's behaviour starts to change accordingly. How we tackle that, I'm not sure. But
Margaret Thatcher was asked what her major achievements were, and she said Tony Blair. But a second one, I think you could claim, was we are actually more selfish than we were a generation ago. And you see that in the social attitude surveys. People show less compassion and are more individualised than they were a while back. And that makes it the more difficult, I think, to reform policy and to make change.
I think, another thing that we are using a lot within homeless health is essentially the concept of peer advocacy, experts by experience, that's as we often refer to it, and so working with people with lived experience of homelessness who can tell their own story, but supporting them to do that within environments where it could be useful. So, for example, some of our undergraduate teaching with medical students, we bring in experts by experience to talk to them about the real experience of that, to try and break down some of these stigmas and engender empathy. And similarly, charities will do that to talk within health services, or could potentially be within social care services and things. So giving people their own voice at the level of service, but also within that context. For example, in the conferences that we hold around homeless health, we make sure that we do invite the politicians along and put people with lived experience on the stage, so that there is a direct line to the voice. And so is that research? I don't know. It's certainly advocacy and supporting advocacy. And I think you can, as a researcher, you can become involved politically. You can become involved in charitable organisations. Often value the skills of researchers in advising them on how to evaluate the impact of their work, for example. So there's many ways.
Good.
I think I agree with Andrew that there's lots of ways of doing this. So I volunteer helping 11-year-olds to read. That's not necessarily using my skills as an academic, but I talk to them about what I do, that I work in a university. I explain what a university is. That's giving them a broader horizon than they might have had otherwise. Her goal, Katie's goal, is to be a graduate. She's trying to go back to her course at the Open University. Aspiration, goals, setting for people who are otherwise told they are useless and pointless and not valued by society can be really important, and it's something we can do because of where we work and where we study.
Scandinavia.
Yes, Scandinavia.
And that's, it's really down to how they redistribute wealth, it seems to me, and taking conscious decision that seems to be well supported by their society to do that. I was hearing in some Scandinavian countries they have a marvellous thing, I think, where rich people get together to boast about how much tax they've managed to pay in some ceremonies. To me that seems a great thing. Graham's absolutely right. We do have to tackle the other end as well, and think about the behaviour of the rich, as well as we tend to spend all our time thinking about the behaviour and of the poor, but it works both ways. So, and when you look at the spirit level, I think you see that, I think really consistent evidence that how we distribute wealth is fundamental. And so many things follow from that. People in a stressed system will exhibit bad behaviours, people working in those systems as well.
I agree with Andrew, and the risk of making you slightly more depressed than you now are. I would just refer to a sort of neoliberal tendency. I mean, I have a lot of close colleagues in Norway who have a right-of-centre government, and they are worried that they are going in our direction. Sweden is noticeably more unequal than it was even a decade ago. So these processes, which I would argue, are affecting us, are even affecting the Nordic states, although they start from a much better position, as Andrew says. So it's a global tendency, I think. It doesn't mean it can't be subverted or changed. And I think, as a sociologist, the main threat to those who are, I think, taking full advantage of the power that they're currently enjoying is what one German theorist, Habermas, called a crisis of legitimation. You can't go on becoming more and more unequal and delivering more and more Daniel Blakes without eventually having a reaction. Mm-hmm. And it's a reaction against the state, whichever government happens to be in power. And perhaps the best prospect of a real shift in our policy programme is through population-generated pressure on a government, saying, you are unelectable, you cannot do this, and nor can any successor government. But it is a global, when I say that sort of the elites are global, Bauman called them nomadic. It's as if they have no national home or commitment anymore. They will move their capital wherever. So for the government of a nation state to take up that challenge is very, very difficult indeed. I hope Corbyn gets a chance to try.
People do interventional research in this sort of area. For example, there's been research about the impact of what you might call the housing first model, which is whereby you really try and deal with the homelessness immediately and get people into houses rather than try and sort out all of their other problems, and looking at the health impact on that. People have done research, for example, on things around, it's a narrow area, but things like how you deal with hospital discharge planning for homeless people. So you can do interventional research, but it's not necessarily easy. And in order to be able to do it, you need to develop the relationships with the organisations and sort of local governmental organisations who have who are interested in dealing with this problem, but have an ability to change the system and but to build your evaluations around that at the same time. So it's possible, but difficult.
Just very quickly to agree with that. I've been talking, if you like, at the macro societal level. There are a lot of interesting interventionist projects going on at local levels. And to pick up on the point made earlier, I think it matters how all of us behave in our jobs and outside our jobs and engage in the way that Nicola was talking about earlier. So it's not just a macro issue, which seems insurmountable. A lot of good local initiatives are taking place all over the country.
Yeah, and get involved in them because they're being cut too.
Yeah.
Libraries are closing. Libraries is an interesting example where I'm part of a campaign to try and save my local library, which has computers in it. The next nearest local library would be a bus fare away. She misses the bus. She goes the wrong way. She fails to claim benefits as a result of it. If you can't walk to your local library, and the government defines 1.5 miles as local, which for many people will not be within their walking distance, probably not Daniel with his heart condition. If we close our local libraries, we lose the access to the internet to fill in the forms to claim the benefits. So there's all sorts of things that we can be doing at a local level that might actually address somewhere in the chain, but also campaigning to keep them open in the first place. My job centre when I lived in Leeds, I signed on briefly, pregnant, Liverpudlian, all the stereotypes that might go with that, notwithstanding the fact that I was awaiting my viva for my PhD. And there was nowhere to sit in the job centre. The woman in the job centre has to move somebody up for there to be space for Daniel, who's got a heart condition, to sit down. So I sat on the floor. I was pregnant, I just sat down, I sat on the floor. When I got to the claim desk, the man said to me, "We did ask for chairs. We got £1,000 and we were allowed to spend it on something. And the management decided to spend it on a party for themselves."
Happens in universities too.
Absolutely. I mean, so, for example, some of the work that we were doing in homeless health and trying to initiate a service to do tuberculosis screening across London. Essentially, we did research that showed the very high level of tuberculosis amongst homeless people, and the fact that we could screen, identify people, that work would actually be cost effective. Could we get it commissioned by the London Health Service? Well, yes, in the end we could, but it was an enormous uphill struggle. It involved a lot of parliamentary questions. It involved working with all party parliamentary groups to show them the evidence, to do things like I said, with experts by experience, so that they could tell their stories about how they'd been saved going on to this. So you're mixing facts with it's heart and brain at the same time to politicians, and they can put influence to some extent on CCGs. Every time the funding was about to be pulled, then we'd make sure that we got it up in the media, and eventually, after about 10 years, that's now become a fully running service that's not under any threat. It's doing more and more related issues. We were sitting with somebody from the Chief Medical Officer's office just last night, screening there, banging on her ear about how wonderful this service is, and we need to expand it to other parts of the country. But you've got to get out there, and you've got to not just publish your paper and think that's enough, because it isn't.
I think the future of social media is going to be interesting. I mean, if you look at the Labour campaign, an awful lot of it has been based on social media. And there are millions of people, as you know, in Facebook and Twitter and so on. Whether it has any effect in translating into votes, we don't yet know. But it's an interesting test case. And you can certainly reach a lot more people. I'm an amateur at this, I do it a bit. But there are people with 1 million followers, And if you get them to take up an issue, it's a very much more effective way of spreading information, maybe policy debate, than, as Andrew says, publishing an article. So I think there are innovative ways that we are yet to test out. Probably.
I think also possibly getting involved in things like the filmmaking. It's not something I've done, but the first question I was asked after I presented the evidence on extended working lives at a conference last year was, does Ken Loach know about your work? So I tweeted him, I didn't get a reply, but I tweeted him, and I thought, actually, this is something we need to explore. We need to explore people who make fictional as well as factual, because these may be more accessible to people. Probably the only concrete example I can think of really influencing policy was when there was a decision about to be taken to not have a 2011 census. We did have a 2011 census, and it looks like we're going to have a 2021 census as well. And I pointed out that we would probably be the only civilised society that didn't either have a population register or a census. A population register means ID cards. And the kind of people who don't want to pay for a census definitely don't want ID cards either. And so a census was far less politically sensitive to pay for than an ID card scheme. So sometimes you have to be a little bit kind of, subvert the argument slightly.
Does that leave you with some enthusiasm for
I think you should have enthusiasm for it, because you can make a difference, both in your work and what you do outside work. Like Graham says, we can't change easily the huge forces that are driving many of these things, but there's stuff that can always be done at local levels to improve things.
Gramsci, pessimism of the intellect, optimism of the will.
Good. That's a nice thing to end on, I think. I hope you join me in thanking our panel members. It's been very valuable. I'm sure you'll agree. Thank you.